Okay, good afternoon, good morning, everyone. Welcome to this precious gathering as we celebrate World Mental Health Day 2023 yesterday. So it's still, we are still on the day of celebrating. It's an honor to be your moderator for this important event, which carries the theme of this year mental health is a universal human rights. Today we come together to emphasize that mental health is a basic human rights for all people, regardless of who we are, where we come from. So every individual deserves the highest attainable standard of mental health. So the key messages we'll explore today are clear and non-negotiable. First, we will affirm that mental health is a fundamental human right. It is a right that encompasses protection from mental health risks, access to available, acceptable, and high quality care to the right of everyone who experience mental health. It should be there is some independence, inclusion within the community, and this is this principle that we always advocate with the Global Mental Health Peer Network. So the significance of good mental health is vital to our overall well-being, but tragically, one of 8 people worldwide living with mental health condition which impact their life, which many of them are experiencing human rights violations. So today we will hear the story and learn with our extraordinary speaker, Mima from Indonesia and Mustafa from India, learning their experience and sharing about the human rights of people with mental health. Yeah, there will be many stories. So I forgot to introduce myself. I'm Anto from Indonesia. Will be moderating and uh, also speaking as well at the end of the sessions. So the first, without further ado, I will introduce Mima from Indonesia, which her original name is Luthfia Adisti, but we can call her Mima. So she's a survivor. She's an advocate about motherhood issue, and we will her story. And you could explain more about yourself as well, Mima. So without further ado, you can start your presentation. Thank you.
Thank you, Sugianto, for introducing me. Thank you, Global Mental Health Peer Network and Mother Hope Indonesia for having me. Good afternoon, everyone. How are you guys? All good?
Very good.
Okay. Okay, it's me, Luthfia Adisti, but you guys can call me Mima. It's such a nickname for my son, so everyone's and everybody nowadays is call me Mima. I'm a mom, a wife, also a teacher. I'm teaching elementary school, high school, and private school. And then, yes, as Mr. Anto said that I a survivor of PPD. So I'm glad to be here to join with you guys in this afternoon for sharing and discussion about the mental health and mental health for mothers. So yeah, thank you.
Yep. Mima, you said that you are also a writer. I think I read your profile. You are also a writer. Can you tell me about that a bit?
Yeah. Since I'm being a mother that I'm having nature of the writer because I have a lot of assignment from my psychologist and a lot of assignment from my psychiatrist to healing myself. to write. So since I'm being a mother, I start to write again. I'm journaling. I'm posting on social media, on my caption on social media. It it makes me feel relief, I think. And then now I'm a process to writing the book for Mother Hope Indonesia with others. So I share about my own experience about the survivor of PPD and being a mom and being a mental health survivor also. So yeah.
Okay, that's nice. Good luck with your writing. Hope it's already. Hope it will be published soon. Okay, then I will be questioning about your experiencing of postpartum depressions. So maternity leave is one of the rights of female workers in Indonesia, but moreover, yeah, if they're having a mental health problem in Indonesia, based on some laws, uh, the pregnant females receive 15 months leave before the giving birth and 15 months after giving birth. You get the proper maternity leave according to the law, and what impact will it have on your mental health after giving birth? So yeah, you share about that.
Yeah. Thank you for the question. It's such an honor for me to be here to sharing about my own experience, especially to the maternity leave. Uh, did I get proper maternity leave according to the law, especially the Indonesian government, Indonesian law, and what impact that I will have on my mental health after the giving birth? So I really appreciate the government contribution to providing maternity leave to support women, to support mothers. But in my own experience, when I was pregnant and I was giving birth, I was not yet a permanent employee. In other words, I was a daily worker in a large company. So I worked there for approximately 7 years. So um, before I giving birth, my company and I coordinate to which HR team that they find a best way for me to get some more rest at home, because my position was still an employee, permanent employee. Yeah, I was still a daily worker, so I was only given the opportunity from the company to rest for 2 weeks. So maybe I didn't get any proper maternity leave, but I appreciate it. I appreciate the company to give some effort for me. I was giving birth on October 17, 2018, and back to work on October 27 to 2018. So I only have 10 days, I think, at home. Yeah, because I was not yet a full-time worker at that time. So that was one of the things that made me trigger and made my situation getting worse. So I was still restore my energy after the giving birth, and then in other hand, I didn't want to be at home with my baby and with my family. So I feel like if I had more time to off to rest, maybe the bad things will not happen to me, and then maybe I feel much better, and that what I felt and thought. But the Indonesian government give the maternity leave for the mothers 1.5 before and 1.5 after. For me as a survivor of PPD, it is very quick. It because I didn't get it before, and it doesn't mean I don't respect the rules. I really respect the rules, because we just need a lot of support from the government. We need a lot of movement, a lot of encouragement from the government to support this, so to support women, to support mothers in labor. Because 9 months of pregnancy, I think the mentally it can be damaged within 24 hours, and it takes years to heal, but we only give the 3 months to restore our energy, to restore our mind, to restore our spirit, to back to work. So the government should be aware of what happens to mothers, what happens to young mothers, what happens to the new routine. So the government should be giving new mothers right to rest more longer at home, so the mothers can recognize their lives, recognize their self, and
Okay. Okay. Yeah.
ready
Can
to
yeah. Sorry to cut you. So to
yeah.
clarify, so the government only give 1.5 months and a 1.5 month after and before. I mean, on the right of giving birth and after the giving birth. Oh, I think so. It's only 3 months. So you think that was not enough? And another question is, did you get any stigma when you become a mother, and how do you overcome that?
The stigma that I got, that on that time when I was become a mother, those people said to me, as a woman, I should be able to accept the nature and the destiny of God, because the woman do feel the pain of the period. Women do feel the pregnancy, feel the pain of giving birth, feel the pain of postpartum. And then those people also said that because I didn't like children, that's why I got the PPD. And then they told me about you already become mom now, and you have to sacrifice your everything you have, including your time, including your work. And I think you're wrong. They said in a inappropriate way, and direct to judge me, and no purpose to give the rude words and unpolite. I think
So
the
did you get any support from anyone at that time?
my I only get the support from my husband, my husband and my family, because at that time my family um is has already knowing about what happened to me, what's wrong with me. And they realized that something bad happened to me, and then they realized I get the PPD. My mom taught me because she show about my behavior with my son. So the one and only support system at that time, only my husband, and then my family. It getting slowly to understand, to make them understand about my condition at that time.
Okay. Yeah, at least you got support from your family. So did you able to access the mental health services at that time?
In my own experience, my husband told my nurse about my behavior, about my change the behavior to my son. And uh in Indonesia, the local government has placed psychologists in each and sub-district community health center as a first aid. The very first time I met the psychologist in the sub-district local government, and then they focus to educating the local community to realize that there is mothers and there is new mothers and there is mothers to be. They should be care and assist to be able to process their new role and avoid bad happens to them, avoid suicide attempt to new mothers and me. And then I have first aid from the nurse and the psychologist. They contact me. They asked me to visit. They asked me to visit the doctor and tell what happened at that time.
So do you think that your government is already give like enough support in terms of mental health quality regarding to the human rights of the people with postpartum depressions, especially based on your experience? What do you think? Can you like evaluate Indonesian government about this issue? But this is only specifically on postpartum depression. What do you think our government already give the providing the services?
I think the Indonesian government is maybe they have the rules, they have the law, but they're not enough to implement to the society. And then there are a lot of people, and so many people in Indonesia is still underestimating this mental health issue because they having no access to know about the what is a mental health issue.
So is that what brings you to this mental health advocacy, like defending the issues of postpartum depressions? So from your story, I think you are like lucky to have support from your family and also some mental health services. Can I say that, or do you have any opinion on that?
Yeah, because my mom is work in the social government, so the my mom is used to be taking care of the pregnancy women and the new mothers.
Yeah, you muted. Can you unmute yourself, please? Nima?
I think it could just be a mistake.
Yeah, okay, Mima, can you unmute yourself? So, okay, yes, Sandra, postpartum depression is still prevalent from women globally. Okay, thank you for sharing. So, yes, if it's possible, Mima, can you turn on your mic again? So yeah, it's great to hear the story of Mima. Yeah.
I'm sorry, I need a little bit of cough, so
Okay,
I
that's
cannot
fine.
I cannot speak a bit. Wait a minute.
Okay. In the meantime, I will like summarize your story. It's like you have postpartum depression, experiencing it, and thanks God you finally get through all. And my last question was, is it what encouraged you to join the advocacy of postpartum depression in Indonesia? What drives you?
What drives me? I'm share this issue. Maybe I think almost every day I am sharing on my social media about the mental health. It's not to scare people, but I'm going to build and rising awareness about my friends, my close friends, my family, my other people in the social media, because the mental health is very close to us, especially for mothers. So thank God I having the PPD, and I met a great people on the my support group and my community. So I think the PPD will be lead me to better way, to the brightest way, to the brightest future with my son. But I still keep uh stand for the mental health issue, because so many people in Indonesia still underestimating this issue. Even my husband, my husband's friends, my sister friends, there is still underestimating the mental health about for the mothers, for the new mothers, for the unmarried people, unmarried women. Yeah. The government is should be provide easy access to psychologists and psychiatrists to provide companions and medicine for mothers, because new mothers can be treated quickly if they identify have the symptoms of the PPD. So yeah.
Okay. Yeah. Thank you. So yeah, I was about to ask about that. Actually, according to the Global Alliance for Mental Health, 75% of mothers who experience mental health problems and are undiagnosed and untreated. Similarly, what happened in Indonesia, I think we can speak for Asia. In Asia, especially the low middle income country, has the same experiences. And yeah, furthermore, can you give more suggestions aside from what you're stated and about the mental health service for pregnant and postpartum women regarding to the rights of accessible healthcare in and the rights to work? What do you think? What should be done?
What should be done? And the government should be we need a lot of support. Before the government, we need a lot of support from our circle first, our family first, our closest friends first, and then we speak a lot. We speak loud in our social media, in the support group, in the community, and then uh family must be understand and familiar with this issue before it's too late, before the mother is undiagnosed and untreated due to a lack of treatment. In Indonesia, the local government has placed psychologists in each sub-district, right? But the focus on there is uh, uh, slightly it's not enough, I think, karena because they should be care for the mother, assist the mother to be able to running their roles, and the government also should be have the special regulation that can be enforced, not to specialize but the jointly break the stigma, prevent suicide deaths for the mothers, for the baby, prevent the rise of mental health in the community. For people who live in remote areas or limited in accessing this due to a lack of knowledge, it is better if the government socialize regularly to be able to spread and educate the issue on the layers of the society. And the government is also obliged to provide easy access to mother, easy access to the family, easy access to the community. So new mothers so can be treated quickly, because there are
So yeah,
so many. understanding.
So agree with that. So there should be more prevention efforts, prevention actions on the preventing the it is happening from since the beginning. So that and of course the government roles is very significant, but I think we as from the people who work, I mean who work in the users and in the people who have mental health problem, we can advocate that as well. So I think thank you for your uh, story. I think everyone agree that you are very strong and able to share your story here with Global Mental Health Network. So actually, we can go to the next speaker. Actually, it should be. Thank you, everyone. So, if any other question
Thank
about
you.
about Mima's presentation and Mima talks, you can just put it on the chat box or in maybe in Facebook, in anywhere. You can just text and we can discuss it after this. So the next speaker should be Mustafa from India. He should have about talk about the child protections, about the human rights in that area. But since he's not able to make it, so I think I should share my screen and my turn to present. So then we will discuss about my presentation. Actually, my presentation is about our theme today about mental health theme about this World Mental Health is human rights today. So I will talk about that. Actually, I will discuss what is the theme of this year topic, which is mental health is the basic human rights. Is it really true? Because we can see, we can reflect everyone whoever where we are has a right to attain a good standard of mental health. So this is included to uh, protection from coercion, protection from the human right violations. It should be in a good quality care, the right to be independent and accept a good quality. But yeah, then we can reflect later. We can discuss what happened in the Asia, what happened in this region, in India, in the Singapore. We can compare. We can compare what happened in Thailand and Philippines. Actually, we can see from many research. So WHO also encouraged that we must challenge the stigma and discrimination surrounding mental health. At least what we are doing now with the Global Mental Health Network, we are keeping advocating. We are thankful that now joining many people from many field area in the, for example, about the child protection area, about about the uh, about the postpartum depression, about the human rights, about the mental health globally, mental health in general. So we have to advocate this to end the discrimination within the everywhere, like school or the workplace, for example, like what Mima experienced. That's a good example that we are doing it. So we also should have the right to live independently and be included in the community. Someone who has mental health or mental illness or mental health problem mostly in many countries are being stigmatized, unable to gain the equal opportunity of getting the job or continuing their job. In many stories, we heard that people are losing their job because they disclose their conditions to their superior, to uh, their community, being excluded and unable to live like in a good quality. People not included within the community. There are many stories. And what happened in the Asia region? Are we already uh, attaining this ideal situation. So this is also my question to everyone who's here. And reality check. I want to do some checking. Is there any substitute decision making or supported decision making implementation in the region? So speaking from Indonesian's perspective, our government are starting to recognize, but it is very hard to implement this because uh, the the medical model that being used, like in the in the mental health worker center, it's like every decision mostly being decided by not the person itself, or having a consent is very hard to do implement. Like the informed consent is not really implemented in the services. So many institutions, many mental health facilities haven't really implement this. Yes, some already, yes, in some region, for example, in the big city like our capital city is already like, yeah, some already ideal, but in the region there are a lot of practice that still violated the rights of people with mental health problem or mental people with mental illness. So what about the UNCRPD or all the international law about protection of people with disability and human rights violation cases? From many research stated that the numbers of Chinese are still happening, in the region, especially in the low middle income country. I think India and Indonesia has some similarity and also in Philippines, there are still some Chinese cases, not just some, I mean thousands. And although WHO has already published the WHO quality rights, how these regulations or guidelines can be implemented. So it's still a question for for everyone in Indonesia or anywhere. How can we implement this into the service? So that is also still question. In some region in Indonesia where all the facility are adequate, it could be implemented by a lot of training. But once again, I stated that the cases are still happening, and the services haven't really addressed the rights of people with the mental health problem that being in the service. So there should be as well. We also encourage the lived experience and mental health survivor to be join the part of the advocacy. I think what we are doing it now is global mental health care network. There's been a good collaboration and networking. We are expanding our network to be part of the advocacy in the globally. So, for example, now the Motherhood Indonesia, the postpartum depressions issue that being advocated in Indonesia, also joining the global mental health care network. So we are we are gladly to join our forces to advocate the issue. So by knowing our mental health rights, we can stand up what is right for us, for everyone. So these are the critical question that I am trying to engage with the discussion with us. Everyone is here. Will welcome to participate and asking. So I will stop my presentation from here, and we can discuss for further question and answers. So please welcome anyone. So yes, Stephanie Huyung, thank you. So you are commenting that, yeah, this is sad because when we raising awareness about mental health, but financial issue and education still affect many mothers in Indonesia indeed. And also the stigma about mental health issue is still taboo to talk for many reasons. And this is part of the stigmatization where faith and cultural and social value in many countries are opposing the principle of a mental health campaign, which is maybe it's okay to talk about mental health issue. So thank you for sharing as well, Stephanie Puyung, about your experience about mental health issue and stigma. Sandra, yes, please welcome to share and talk.
Hi, thanks, Anto. Firstly, thanks, Mima and Anto for presenting today. I think we all know within a lived experience space how important it is to share our experiences. I mean, some of you might know the Lancet Commission for Ending Stigma and Discrimination. One of the findings within that paper was that evidence shows the most effective way to end stigma and discrimination is by involving people with lived experience. That's why it is important for us as people with lived experience to be actively involved within processes within mental health from the top all the way down to the bottom, kind of thing. You've both spoken a bit about implementation, and I think it's something we all feel, specifically, obviously, in my situation. I'm also in a low middle income country. And we've got lots of, if I can say, beautiful documents on paper, but the problem comes in when it comes to implementation. What do you think are the most effective ways to actually implement these policies? And taking it away from the government for a second and just us as communities, how can we support the implementation process, in your opinions? If I can ask both of you to answer that, I'd appreciate that.
Yes, Purnima, you want to share your opinion?
Thank you, Sandra. Thank you, Anto. I think, in my opinion, for the implementation, the government or the community or the family first should be having the rules or the guide about the detection of the mothers to be, as Miss Yana said in our last workshop. If the mothers came to the hospital to checking up the baby while she pregnant, she only asked about the how's your egg, or weight, or the blood, or the height. The doctor or the nurse never ask about our feeling. How's your feeling today? How are you today? And then the doctor or the nurse never ask about are you good? Are you feeling good? Or what happened last night? Or are you enough of sleep? Yeah, it's simple yet, but it makes prevent or makes the mother to be or the pregnant women to feeling happy about oh, the doctor asked me, the doctor pay attention for me, not asking the baby, but they asking me how I feeling. And then yeah, it should be start with small things. Small things that we need. It can be increasing our mood, our energy, and then they can be prevent the bad thing that mom would be do for the baby.
Yes, totally agree, Mima. So there should be some skill training on the mental health worker that related to the issue. For example, the postpartum depression, there should be skilled worker that's being trained by the government so that they can engage more and prevent the situations since the beginning. If I can summarize your answers. So while answering Sandra's question, I also have some answer, which is, of course, ideally there will be a whole collaborations, multi-sectoral collaboration between the government, between the society, between the community, between the lived experience to hand in hand to address the issue. But in practically that is also very hard to do. So at least in terms of perspective of lived experience and users organizations, I would like encourage everyone to speak about it, like globally, anywhere you can in your workplace, advocate ourselves, to talk to our co-peers, worker, to talk to our superior, to talk our, then to educate them. I mean, to educate them a little by little. It doesn't have to be bluntly to say that I have this condition. No, but if we can just, if we are not ready yet, then we can tell the mental condition is like this, for example, and everyone could affect this. So we should not stigmatize people with mental health problem, for example. Then we can go uh, elevate that into like a real educating someone or the authority advocating the issue with the government, so that we have the voices to be delivered, so that the policy can be made. So what I do actually as a lived experience advocate, because when we are talking to the government, there are a lot of bureaucracy, administration, and the process of very long time when we advocate some policy or regulation. It took very long time. So I think we need some shortcut, which is, I think it is a great platform, like a global mental health peer network, to be able to advocate this globally, so that we can have international attention, so that eventually our government will take it as a very serious problem. So yes, either way, we also encourage government to keep on the, increasing the quality of the services and also the health worker. So yeah, I will go to the chat box. So the message for Mima is, yeah, Mima, you have a message from Facebook. How effective if the legal government addressing preventing human rights violation in Indonesia? We can answer this. And actually for Mima, what advice support would you offer to mother with similar situation dealing with the issue with the stigma?
What my advice to my mother or the
Yeah.
family
To other mother,
to other mother?
yes,
What to
with the
break the
similar
stigma?
situations, yeah, dealing with
Okay.
this issue of stigma.
Okay. Firstly, I would like to say that I'm not ashamed that I have mental health. I'm not ashamed to share my story and my experience to others. I'm not ashamed to declare I am a mother. I have a PPD, and then I stand for human right to our mental health. Speak a lot, speaking loud, and then embracing our disease, our health, because we have to think about our quality of life, our generation, our heart first. So I'm not ashamed that if I have the mental health, and then so the other people can be wise to treat us, to behave, and then to prevent suicide attempt, to prevent harm and kill the baby and or the mother itself. So we have to stand for our human rights. We have to stand for our health first to make it work better.
Thank you. That's very encouraging statement and very brave, bold statement. That hope there are a lot of people that able to share the story and advocate this issue. So, is there anyone here who want to raise your question or hand before I continue to ask? Okay, I think yes,
Sorry,
anyone?
Anto, I think Yana, if she did put a
Yeah.
question on the chat. Yeah.
Yes. Okay. Yes. Also answering the how effective of the legal system and government been addressing violence in Indonesia. I think government and our legal process, because now the new regulations of protecting people with mental illness is being established again. You know, the new law that being discussed, because I joined the policy meeting, is still on the process again. At some point on the protecting of human rights of people with mental illness in Indonesia has already included. So, but in the real setting, the implementation is always hard to do, because, for example, the practice of coercion, the practice of chaining are still happening. We cannot just punish people or family with the law, like putting them in jail. No, because it's also, there are a lot of reasons behind that. It's not always like they intentionally want to put this person in chain, for example, but this is kind of the protection. The family want to protect them in their way, and also it's a cultural value that's still seen. This practice is part of the method of curing. So, for example, so there are some debate on that. We are still progressing. I hope it takes time to attain an adequate mental health service in society. So and Yana asking about how to support friends who had mental health issue in the workplace. In our opinion, I think it also started with ourselves, when we should educate ourselves with the issue first, and we knew what to do, and it should be the right way, and we should not giving judgment or stigmatizing by saying, so you lack of faith, or just undermining their feeling. We should recognize their situation, like giving them sympathy, be a good friend, just by listening to them. Okay, what do you need to help? What is your feeling? How are you doing? And is there anything that I can do? Then we can refer them to the professional. I think the simplest way is like that. And in the more advanced ways, like we advocate the authority within our workplace to be more friendly, to be more human to the people, like, you know, the value of humanity, where mental health issues should be addressed in the first place. For example, I have this depressions, then they should have the rights to live, like have a live, like have a break, like not working for some days. Then it should be a mutual understanding. I think that way. So if the company does not give any support of fair regulation, so there are soft way and the hard way. The hard way, we should advocate this issue, and with the regulation, with the government, with everything. So, and we can make a campaign that because nowadays, for example, the social media has a power to do that, because we can advocate that through. Of course, we should choose the safest way that protect our job, and say not really threatening our job. So we can either advocate it into our superior in a good way, talk to them, and the government are still now um, trying to make it better. But at the end of the day, it should be like everyone's matter, where multi stakeholders should join the issues. So me, Yana also say that we hope that maternal mental health care can be promoted as well, to the government promoted about breastfeeding. Okay, I think that's the issue of the mothers. So I think we can hand in hand to advocate this to our government. I think I'm not going to speak just for Indonesia. I think it should be in whole Asia. Yeah, we should have some similarity because low middle income country has similar problem. I think we would like to know what happened in the region. So we'll talk to. Can I reach someone here? Manjula Pradeep, you stated about mental health education in the education sector. Can you tell something about that? Your statement.
Yeah, thank you. I think when I was listening to the lived experience of Noor and also your presentation was very important. I was just thinking about because in my own lived experience, I experienced the trauma at the age of 4 when I was sexually abused. Now the point is that this situation happens in your own like surroundings, and you're still a child and where you are not in the school, but these kind of traumas, when you take it in your education, like in your school, see, there's no possibility in that sense that the child who has gone through, and there are so many of children who go through this kind of situations, they don't get that kind of space. One is that I do know that there is some kind of counseling which has started now, but what kind of counseling, one doesn't know. The other aspect is also like, if this mental health is part of the curriculum, what I mean to say is that it can be a subject, because the child can relate it to, and there are so many lived experiences of the child as the child is growing, and I think it really helps. And so it can be started at the elementary level, but in a very basic way, but slowly the child can be also made understood that what does mental health means and what does mental well-being means. And I think that will also help in uh, in also releasing the pain and the trauma which the child is going through. Maybe it could be in the neighborhood, in the school, also in their own families. And I think these kind of situations do happen, but I don't see that kind of possibilities which are there in the educational system, where they see mental health as part of, like, we have public health as one of the subjects, but there is no aspect of no space for mental health in the education system. So that's why I raised this point. Thank you.
Thank you, Manjula. Thank you, Manjula. I agree with that. Totally agree, because the education, like in school, people should be introduced to the education of mental health itself, and so that kids in school, they're aware of that. So also it will apply to the higher education. So it should be in the education system. There should be some education about mental health. So totally agree with that. So thank you for a very engaging discussion here. Thank you, Brian Anderson, who was joining with us from another region. So he joined and commenting. So courageous Mima and Manjula as well. Thank you for sharing your story, your experience that. So I think we almost come to the closing stage, closing part of this event. Yes, Sandra, please.
Sorry, just before you wrap, Anto, I just wanted to say thank you from the Global Office to both you and Mima for presenting today. It's a very engaging conversation. You did a fantastic job as a moderator, as obviously we would expect. I always remember that video you shared with us of breaking the chains, and to see where you are now, it's really incredible. So well done to you for all you are doing for mental health as well. I regard you as one of the top experts globally. So thank you for everything you did. And Mima, yes, as well, thank you for your presentation today, and for showing women who have PPD that there is support, there is help, and there's always hope at the end of the day. So thank you. Thanks, Anto.
Thank you, Sandra. Thank you, Global Man Healthcare Network. Thank you, Mima. Thank you, Yana. Thank you, everyone who's joining us today. So at least we deliver a good message, which is we should know our rights, to advocate the rights so that we can adequately achieve the mental health is a universal human right for everyone. So to wrap up, and I would say like keep our mental health in a good condition so that we can advocate and keep spreading the advocacy throughout the world. Yeah, thank you, Global Mental Health Network. And I think we can summarize and close the session for now. And thank you, everyone. So yeah, see you on the next event of Global Mental Health Network. Thank you, everyone. So have a good day.
Thank you, Anto. Thank you, Mima. Thank you, Sandra.
Thank you,